Dear students, welcome back. In the previous session, we have discussed about various methods of electrodiagnosis, that is SD curves as well as the EMG. Now in this session, we are going to discuss about nerve conduction test, which includes nerve conductivity test as well as nerve conduction velocity test. Okay. This nerve conduction velocity, which includes motor conduction velocity as well as sensory conduction velocity test. Okay, and also we can find other type of tests, that is H reflex and F wave, which are also related to the nerve conduction test. Okay, now first we will see the nerve conductivity. So here the conductivity means it is a measure of a nerve's ability to conduct an electric current. Okay, yes, we'll see now. As we stimulate a nerve trunk which causes contraction of the muscles which are supplied by the nerve distal to the point of the stimulation. So if you are getting stimulated at this point, so this is the nerve trunk, and the fibers which are supplied by this motor trunk are going to be supplied to the number of muscle fibers which causes contraction of that muscles. Okay, so that means distal to the point of this stimulation only we can find such kind of contractions. Okay, and testing of nerve conduction is commonly used in conjunction with the plotting of strength duration curves. So nerve conductivity we can measure through SD curves. Okay, an impulse with a duration of 0.1 to 0.3 milliseconds is applied at a point where the nerve trunk is superficial, and any contraction of the muscle supplied below the point indicates that at least some of the nerve fibers are intact. Okay. So when you comparison with the strength of the stimulus required to produce a similar reaction on the unaffected side of the body, which gives some indication of the severity of the lesion. So, and one of the disadvantages of this nerve conductivity test is it does not show whether the fault lies in the nerve or in the muscle itself. When a nerve fiber is degenerating, conductivity is lost distal to the lesion within a few days, and this can give some indication of the state of the lesion and possible prognosis before the full test can accurately be performed. With lesions in which degeneration does not occur, it may be possible to determine the level at which the impulses are blocked by testing at different points on the nerve trunk. Stimulation below the site of lesion should elicit a response, but not the stimulation above. Okay, if you see the nerve distribution, the distribution of the different nerves is subject to some variations between individuals, which may prove misleading the assessment of nerve lesions. So the distribution of a nerve can be determined by stimulating the nerve trunk and observing the resulting muscle contractions. Okay. Now we will see nerve conduction velocity. So here we are going to calculate the speed at which the at which the impulse is propagated along the peripheral nerve, and which is a reliable method for determining lesions of peripheral nerves. Normally, for such kind of test, it needs a suitable equipment. So, nerve conduction velocity we can also done by this electromyography. Okay, here the stimulus is applied to the nerve by two small electrodes fixed to the skin about 2 centimeters apart. Okay, The pulse duration used can be varied from 0.05 to 2 milliseconds at a frequency of 1 to 2 hertz. The recording is made by a different set of electrodes which are placed over the stimulated muscle or sensory nerve. Both the stimulating and response signals are displayed on the oscilloscope. Both the motor and sensory conduction velocities can be recorded. Okay, now we will see this motor conduction velocity. To determine the motor conduction velocity, the nerve is stimulated at two different points. Here you can see at two different points. Okay, at the distal site. So this one is the distal site, that is the wrist, and another one is the proximal site, which is at the elbow. This is the stimulation of the median nerve. Here we can see in this pic. Okay, at the distal side, the single pulses are applied to initiate impulses in many axons to activate the motor end plate of many thousands of muscle fibers, causing a brisk muscle contraction. Okay, so this can be displayed with the stimulus to show the conduction time between the stimulus and the start of the muscle contraction, called latency. So here this picture is somewhat magnified here. So normally the stimulus, we can see here, this one is the small, very small thing. So here it is magnified, and here the distance between the stimulus and the start of the muscle contraction. So at this point the muscle is going to contract. So from starting to here. So for this one also here. So that period is called as latency. The latency is measured in milliseconds from the stimulus artifact. They have used the term called artifact to the onset of this wave. This wave actually appears as an M wave. Okay, here artifact means something observed in a scientific investigation, but actually it is not present. So here if you can see in this graph, you can find the stimulus as a big wave, but in the actual thing you can find it's a very small amplitude for the stimulus here, isn't it? So to show the latency, so this graph is magnified here. Okay, so the latency is measured in milliseconds from the stimulus artifact on the onset of the M wave. Okay, so here this is the stimulus, the end point of the stimulus here, and this one is the starting point of muscle contraction. Okay, so the distance between these 2 points is called as latency. So here if you see, we are stimulating the median nerve at two areas, isn't it? So one is at S2. If you see the latency here, and this is called as distal latency, and this one is called as proximal latency. Definitely the proximal latency is greater than the distal latency. If you stimulate the median nerve, isn't it? So the thenar muscles, normally the recording electrodes are placed at the thenar eminence where this graph is recorded. That is, the myoelectric potential is recorded by this recording electrode, and this one is further take over to this amplifier, and then which is displayed on the oscilloscope, and that in that oscilloscope the type of wave which is formed can be recorded through audio as well as visual aids. Okay, so that is the thing here. So this latency indicates the time taken by the impulse to cross the motor end plate and to provoke muscle contraction. So, how can you identify? How can you identify this conduction velocity means? So, it is having one formula. Conduction velocity is equal to conduction distance by proximal latency minus distal latency. Okay, so conduction velocity is determined by dividing the distance between the two points of cathodal stimulation. So this one, distance between the 2 points of cathodal stimulation by the difference between the two latencies. Okay, so conduction distance by proximal latency minus distal latency. In this way, we can find the motor conduction velocity. Okay. This conduction velocity is always measured in meters per second. The value for the motor NCV in the upper limb varies from 45 to 70 meters per second with an average value of 60 meters per second. For the lower extremity, the average value of NCV is about 50 meters per second. NCV means nerve conduction velocity. Okay, conduction velocities of the two sides can be compared and checked against published values. Okay, next one is the sensory conduction test. So, the sensory conduction test is also measured in the same way of the motor nerve. However, there are some differences in the technique. All the sensory nerves can be tested using the orthodromic conduction. That means in the physiological direction. So the terms called as orthodromic means in the physiological direction, or antidromic condition, opposite to the normal condition. In these two ways, we can measure the sensory conduction test. Okay. Orthodromic measurements appear to be more common, that is in the physiological direction. For this reason, the sensory axons are either stimulated or recorded from the digital sensory nerves. Okay, so these all these values are calculated from the digital sensory nerves. So for the purpose of sensory nerve conduction velocity testing, the electrodes used for the motor NCV test can be used or can also be made up of with digital ring electrodes. That means here the electrodes are placed at the thenar eminence like this. So ring electrodes means, so for example, this is the finger, this forms a ring like such kind of electrodes can be used. Okay, normally the recording electrodes preferably a surface are placed over the nerve trunk where it is superficial. The active electrode is placed distally, and a ground electrode is usually placed between the stimulating and the recording plate electrodes. Okay, but here the stimulation point in the sensory conduction velocity is only a single point. In the motor conduction, we have stimulated the points at two levels, isn't it? Yes. So that is the difference there. Okay. So normal sensory NCV ranges between 45 to 75 milliseconds. The amplitude measured with surface electrodes may be 10 to 60 microvolts, and the duration is very short, that is less than 2 milliseconds. Okay, this is all about the nerve conduction velocity. so which includes motor conduction velocity and sensory conduction velocity. In the next session, we are going to discuss about the other nerve conduction test, that is H reflex and F wave. Thank you.